Welcome to season 2 of Let's Talk About Acne. My name is Shanna Miranti, and I'm a dermatology PA from Naples, Florida. I'm joined today by two of my all-time favorites, Dr. Julie Harper and Dr. Hilary Baldwin. Welcome, ladies.
Thanks for having us.
Yeah, absolutely. So acne is certainly one of all of our passion projects. We love treating acne. We love seeing patients with acne, and we love seeing those smiles on those patients' faces when they are finally clear. Sometimes we may be even seeing those patients' eyes for the very first time when they're looking up. And certainly in 2024, we had a new product come out to the market that really revolutionized how a lot of us treated acne by simplifying patients' regimens and giving patients the very first ever triple combination therapy for a topical medication for their acne. Now that it's been out a year and we've had a lot of usage of this product in our practices, what are you all seeing? I know that I'm surprised when patients are not clearing. I almost turn the story back around on them and ask, are they actually using it? You know,
I think it's one of the few drugs with which I'm not disappointed. You know, we saw the phase 3 data. It looked way too good to be true.
Sure.
And it wasn't too good to be true.
That's right.
It lived up to its hype. Highly effective, unparalleled efficacy, and tolerability. It's almost as if the ingredients aren't there. It's almost as if the benzoyl peroxide and the adapalene are kind of missing. I think it's from what I call the special sauce, the polymeric mesh. I really think that added something to it by adding, the mesh itself is moisturizing. It reduces transepidermal water loss, and then it evenly distributes the particles. And it's just, it's something special, which has turned 3 ordinary ingredients into a really dynamic drug.
So are you insinuating that it may be different than layering those 3 individual generic products separately?
I am more than insinuating, yes. And also probably cheaper. I mean, buying 3 separate drugs and uncapping 3 separate medications, not something teenage boys do so well, by the way.
Very true. And paying 3 separate copays.
Yes.
For 3 generic products, which we all know are not always cheap these days.
And guys, we did that for so long and we never saw this kind of efficacy. So yes, it's interesting you say that, because I think to have such a powerful drug, maybe we would have expected some amount of irritation. And maybe we see a little bit in this first few weeks, but this has not. We've stepped up in power, and yet I don't think we've stepped up in irritation at all. If anything, I think we've stepped down in irritation.
Yeah, good point.
And also so fast. I can't get past that part. I had a person recently in clinic, and we registered her for isotretinoin, but in the meantime, I started Cabtreo.
Yeah.
This is a true story. I just saw her back. And she was remarkably better in just 4 weeks. In my clinic, normally I'm seeing people back at 8 weeks. I don't have the opportunity to see 4 weeks very often.
Yeah.
But in this case, I did. And we know from the studies, this works quickly. We have real improvement at 4 weeks. I think half of the inflammatory lesions are gone at week 4 in these studies. And that's really unprecedented.
So let's take that out a little while, from 4 weeks to 12 weeks to now 6 months.
6 month data.
Tell me a little bit about the 6 month data that was just revealed at the AAD.
Well, again, I'm so excited about the 4-week data, but we do want to see drugs that continue to work. But the steep part of this improvement is still those first 4 weeks. We get more reduction at week 12, but we now do have 6 months of data. It's in 25 people. It is an open label study, but by the time you get to 6 months, we've now got a 90% reduction of inflammatory lesions. This is still with 1 topical. This is still with just that 1 pump once a day.
Script.
And then, one script. And then you look at 6 months, you look at non-inflammatory lesion count reduction. We're down 70% there. So it continues to improve, and it's an impressive result that I think does pan out. We've had this now for a year. I think that pans out in clinic.
I agree. It is exciting though, and you made a great point. It's so important to get that early buy-in from the patient.
Yes.
It's almost like itch reduction in atopic
Right.
dermatitis.
Yes.
You know, we need that
That's right.
yesterday.
Right.
So in the acne world, we want to see clearance. You know, patients want that
Yes.
flawless complexion, and they want the reduction in their inflammatory lesions to go down very quickly. So I think you're absolutely right. That 4-week data is so powerful. It's so nice to see when it happens.
And I think because of that, this is one of the topical drugs that I've had people come into clinic. I almost think when I write the prescription, I guess I don't do it like that anymore. When I write the prescription,
I still do that.
For
We're dating
Cabtreo.
ourselves. We're dating
At least
ourselves.
you're
let's do
there.
this. When I write the prescription for
It's really
Cabtreo,
like this,
I
actually,
think,
on the
right,
iPad.
exactly. I think they're like, oh, another topical. You know, maybe they're almost disappointed. But I know those numbers from the trials. I speak those numbers to them when I see them.
I do too.
And when they come back to clinic, they're excited.
Yeah.
Not only am I excited, they're excited. And when I have buy-in like that, when they come in and they say, yes, I want to refill. Yes, I want to stay on this. No, I don't need isotretinoin. And I'm not saying that's going to happen all the time, but that is it's a possibility.
For sure. And if we can avoid patients having to go to systemics and giving them less medication,
Yeah.
you know, and get them the efficacy they want, I think patients are going to be so happy.
Yes.
And we are going to see those smiles and see them sooner.
Well, we didn't mention in the 6-month data that there was good improvement in scarring
That's true.
and hyperpigmentation as well,
That's
which
true.
we all suspected would happen
Right.
based on other medications of similar type that were used long-term up to 6 months. So
Yeah.
That's pretty exciting too.
And
It's
again-
always wonderful to see the scarring reduction,
Yes.
but also
Yes.
the post-inflammatory hyperpigmentation.
Yes.
I practice in Florida, so
Mm-hmm.
my patients all are exposed to sun, and a lot of patients, even very fair-skinned patients, can still have hyperpigmentation that they are
Absolutely.
very bothered by. But certainly for our skin of color patients as well, it's wonderful to see that reduction.
Yep.
So tell me a little bit about what we see or what providers could potentially see using Cabtreo for reduction in scarring.
Well, you know, I don't think I have looked at it enough for scarring. Certainly been evaluating post-inflammatory hyperpigmentation and post-inflammatory erythema as well in the lighter skinned individuals. And I do think from my experience in a non-study setting, I do think that those are resolving faster. They're less likely to occur and they're resolving faster than with other products that I've tried.
And we know from previous studies on previous products
Right.
that if you can reduce that post-inflammatory erythema and the
Right.
inflammation, because as we all know, it's not post-inflammatory, it's
Right.
still currently
Persistent.
inflammatory. It's
Right.
persistent inflammation. I think both of you at one point taught me that in the speaker training. So if we can reduce the inflammation and stop those fires from burning holes in people's skin, quite
Yes.
literally, and if we can kind of tame that beast, we will see certainly much better improvement with scarring and with pigment.
And it's interesting, again, we do want to keep things simple. So often people come into clinic and they're concerned about their acne, but they're also asking those questions, is this scarring? Or I also have hyperpigmentation. And so to be able to get much of this done again, back to our one product and our one pump, to be able to get so much of that done. And I think it is having a big impact, and not having to continue to bring other products in to try to address those problems. I think it's a real win, again, from a copay standpoint, from an ease of use standpoint, and then also from an efficacy standpoint.
If there are other products that would need to be layered in or utilized along with, I know, of course, no products are studied together in clinical trials, so we have to say that up front. But if you do have a patient with a stubborn, persistent hormonal acne, do either of you tend to go more towards spironolactone first, or do you use a clascoterone? What is your preference?
Well, you know, if we talk about acne pathophysiology, which we do all the time, and we all recognize that the more of the 4 pillars we hit, the better the patient's going to do, that the average successfully treated patient is on 2.53 different medications. So we have all of that information behind us. So the only thing that Cabtreo doesn't hit is sebum production.
Right.
So throwing in something like clascoterone or spironolactone, if it's a female patient, I think makes a ton of sense. I know you have an opinion on this.
I do have an opinion. I'm remaining kind of quiet here. So first of all acne is hormonal. We need to
so
remember
true.
that.
That's so
And then
true.
I think, first of all, I would say, yes, I love looking at the pillars. We've all done that. We want to target them as much as we can. But we've got a darn good efficacious drug that we don't think is hitting all 4 of them. We also need to remember, though, that sebum piece of this, that would be the one thing that this triple product is not hitting potentially. Part of how sebum is working in the pathogenesis of acne is it is promoting inflammation.
Right.
So maybe the sebum is not our hit, but the inflammation that sebum is generating likely is being affected by this drug. So I think it's probably time for us to broaden our understanding of the pathogenesis of acne a little bit more.
I love that.
Just to keep that in mind. Now, do I ever use something like clascoterone with this? Absolutely. Do I ever use something like spironolactone with this? Absolutely. But I still have to say, and I'm going to go ahead and say it, the muscle out of all of those is Cabtreo.
I agree.
The muscle out of all of them is Cabtreo. That's just true. We see it in the data. I see it in clinic. And most of the time it's going to stand alone, but there are times that I will pull in other medications too.
Yep.
Do you both typically prescribe this for morning use, for nighttime use, or dependent upon the patient's routine?
I love being able to say, see drug, use drug. Any time of the day you want. The only thing you have to think about is whether or not you want to bleach your pillowcases and your towels.
Right.
Other than that, any time of day.
I usually say nighttime, because I'm assuming that they might also need to use this for truncal acne.
Sure.
And I think it's just maybe I don't like my pillows and sheets as much as I like some of my clothes. So I prefer it at bedtime, but you've got the opportunity to use it at either.
Adapalene is photostable. So
that's right. That's right.
You know what I do like, and I always ask my daughters to do, which of course they didn't do, because I too have towels, pictures of towels with, with brown and
the
purple.
ones where people look like they're going to kill you.
Yes, exactly. Exactly. I ask them, the second you get home from school, you take off your school clothes. They both wore uniforms. So you take off your uniform. That's when I want you to put on your benzoyl peroxide. Let it sit on your skin. I mean, or product that contains benzoyl peroxide is what I meant to say. And then it sits on your skin for 2 or 3 hours while you do your homework, while you eat dinner. And then in the evening, when you're going to wash your face or take your shower anyway, you can wash the whole kit and caboodle off, and then your pillowcases won't bleach. So I asked them to do that. They didn't.
How did that go for you?
Not all that well. But I still think it's a great idea.
But the flexibility of dosing is very nice. And it's nice to be able to say, you can use this when it works.
Right.
We just have to be a little careful. I think, like we alluded to in our first episode, was just about layering of products, layering of ingredients. Sometimes benzoyl peroxide can break down their favorite vitamin C serum, and then they're not getting the benefit from that. So, of course, we need to advise patients that the prescription medications are often not studied along with their favorite skincare products. So we do not know how those are going to play on the playground. So, but I think, advising on moisturization, making sure we're letting them know that the product, any retinoid, can be irritating. So it's important to incorporate moisturization and sun protection.
Absolutely. Sun protection. Absolutely.
Of course. All right. Well, thank you so much for tuning in to another episode of Let's Talk About Acne. See you soon.